Hello, ladies and gentlemen. As the opposition, I would like to point out some misguided facts that the proposition has thrown at us. In the Ashley case, her symptoms are so severe she has to be completely tube-fed every day. She is also incapable of learning how to walk or even change the position in bed. She relies on her caregivers for pretty much everything. Any good parent would do whatever is necessary to ensure happiness of their child. The case is same for Ashley. It is also common knowledge among students that the menstrual cycle occurs once every month for a mature female. In the menstrual cycle, the uterus lining disintegrates and is ejected out from the body. This, at the same time, breast development starts, which also causes discomfort as well. Her parents' goal was to provide as much comfort and joy for their daughter as possible. Thus, a logical step towards this was to remove discomfort. Firstly, the proposition stated that the estrogens would make her breasts grow faster. However, Ashley has had her breast buds surgically removed. Thus, the estrogen cannot promote breast growth due to the lack of mammary glands. Secondly, wouldn't it be more dignified to live in a child's body with a 3-year-old mind as compared to a fully grown woman's with a 3-year-old mind? This is the very sole reason why her parents allowed accelerated bone growth. At the same time, it made her notably lighter and smaller and easier to care for in the process. In the 1950s and 60s, such treatments were available to teenage girls for cosmetic reasons. For Ashley, it is for convenience. In fact, the results from the procedure has shown that she has improved GI tract, better joint movements, higher mobility and flexibility, as well as increased blood circulation. At the same time, this allowed her to be cared for and carried around by single individuals as compared to 2 people carrying her around if she was full grown. In fact, due to her smaller body and increased blood flow, she is less susceptible to skin sores, bladder infections, and pneumonia. In addition, she has no chance of suffering from scoliosis and has reduced effects from osteoporosis due to no longer having any bone growth. Thirdly, as I have mentioned earlier, her parents only wished to give her as much comfort as possible. To stop the menstrual cycle, the most definite solution was to remove the uterus. This not only made it more convenient for her to take care of, but it also removed most of the discomfort. Next, the estrogen therapy lasted for only 2.5 years. Such a treatment will not cause her to suffer from deep vein thrombosis or DVT, nor will it affect her hormonal levels due to the change of blood composition. It is a temporary treatment. Furthermore, these surgeries are simple and were provided by the Seattle Children's Hospital, a world-renowned children's hospital in the US. It only took her 1 month to recover, which is minimal as compared to the years of monthly discomfort. In fact, she exhibited no signs of pain due to mild painkillers. Now, ladies and gentlemen, these are the real facts about the procedure. There are no long-term side effects, thus the symptoms such as DVT or abnormal hormone productions are negligible. Next, the short-term pains are well worthwhile as compared to the future complications and reoccurring pains. Plus, the doctors were not harming or curing her, as the proposition has stated. It is already clear that she is completely incurable of her disability. The doctors are simply doing what is best for their patient. Furthermore, a doctor's oath clearly states that he or she cannot harm their patient. If this procedure was as harmful as you make it, it would not have been carried out. You have to remember, the doctors in these procedures are trained professionals, and they had evidently approved of doing such a procedure themselves. Thus, even professionals consider this to be a very viable option. As such, attenuation of growth should be allowed. It is still a very viable option in our current society.